Swansea. Very good to talk to you, Dr. Hopkins. So, what's going on here? Do you think that the regulations need tightening, or people just need to stick by the existing ones?
Well, the introduction of the vaccine programs is key in helping to tackle the coronavirus pandemic at the moment. But people still need to maintain distancing and act like they have the virus. People should not become complacent because we have got the vaccine. This virus is highly contagious. We are seeing 4,000 admissions into hospitals every day, and normally during this period of time we would only see 1,000 admissions to hospitals with respiratory ailments. We currently have 32,000 people in hospitals, and that impacts on everybody. We all have a responsibility. We also need to look at the restrictions that are currently in place. Wales is in a tier 4 and England is more or less locked down, but we still have restrictions that are looser than they were in March. For example, people can still go to places of worship, playgrounds are still open, etc. We might be getting to that stage where we need to really think about whether we need to close down a little tighter, in particular places of worship, for example, going and viewing properties that are on the market. The key thing is we do need to stay at home. And
stick with it. I just want to explore what you just touched on there, Dr. Hopkins. Do you think people, in a way, even perhaps unconsciously, subliminally, seeing the vaccine, the rollout of the program, seeing the touching distance there, of potentially an end to this, and we can't overestimate that is potential, but nevertheless then kind of excusing their own behaviours if they should cross the line, and that of their friends and family?
Now, the vaccination doesn't give you instant protection against the virus. We still have to maintain the other things that we have been asked to do. Act like you have the virus. We still must act as though we have the virus. What is important about this pandemic is that it's not going to end come Christmas, or however much I would like to see it ending come Christmas. This virus is going to come in waves. It is a global pandemic. And as a nation, we also need to think about what we are going to do and how we are going to support the developing world. Because it's all well and good, we're all vaccinated here in the UK and in the wealthier countries, but the virus will still be there globally in the developing world, and we need to think about the role we're going to play in supporting developing countries to roll out the vaccine there as well, because it will continue to come in waves. It is a global pandemic. It's not just affecting the UK.
Absolutely, that's what the pandemic means. So interesting what you said there about Christmas, next Christmas. So even by then, life in the United Kingdom not remaining the same. You're saying there, COVID's going to become endemic. It's going to be around a long, long time. You therefore think that even with vaccination, with also this large number of people who have already had COVID and survived, Neil Ferguson talking about something like 30% of the population potentially, you still think that there will have to be restrictions on behaviours way into the future?
Possibly. We are going to have to amend our behaviour, because, as I said, this will be coming in waves. When you look back at the 1918 Spanish flu, it didn't just occur in 1918. It came in waves, which lasted a couple of years. I sound as though I'm a bit of I'm bringing doom and gloom, but we need to be cautious. As I said, the vaccination is an important tool, and we are at that critical point. But in the next 2 weeks, our health service is going to see even greater stresses, because we are going to see those people who have become infected over the Christmas period, potentially being admitted into hospital. We are at a very critical point now with the NHS, and we need to remember that, as I said, this pandemic it's not just going to disappear. It will eventually filter out as we tackle it and as the vaccines, become globally available. But we must ensure that we still maintain, those measures that we are asked to maintain. And critically, at this juncture, that is staying at home and isolating yourself and only going out when it's absolutely necessary.
Dr. Hopkins, thank you so much.